Hepatitis A is an extremely contagious liver infection caused by the hepatitis A virus. The virus is one of several hepatitis viruses that cause inflammation in the liver and impair its ability to function. Hepatitis A is most commonly transmitted through contaminated food or water, as well as close contact with an infected person or object. Mild cases of hepatitis A do not require treatment. Most people who become infected recover completely, with no permanent liver damage. Good hygiene, such as frequent hand washing, can help to prevent the virus from spreading. Hepatitis A vaccine is effective in protecting against the virus. Hepatitis A symptoms usually appear a few weeks after you contract the virus. However, not everyone with hepatitis A develops symptoms. If you do, symptoms may include unusual tiredness and weakness, sudden nausea and vomiting and diarrhea, abdominal pain or discomfort, especially on the upper right side beneath your lower ribs, which is over your liver, clay or gray-colored stool, low-grade fever, dark urine, intense itching, joint pain, yellowing of the skin and the whites of your eyes, jaundice, loss of appetite. These symptoms may be mild and resolve within a few weeks. However, if left untreated, hepatitis A can cause a severe illness that lasts for several months. How hepatitis A caused? The virus caused by when infected bowel movements, even in small amounts. You may contract hepatitis A if you eat or drink something contaminated with infected hepatitis A virus. You may also pick up the infection if you come into close contact with someone who has hepatitis A. The virus can survive on surfaces for several months. The virus does not spread through casual contact, sneezing, or coughing. Here are some of the specific ways the hepatitis A virus can spread. Eating food handled by someone with the virus who doesn't thoroughly wash hands after using the toilet. Drinking contaminated water. Eating food washed in contaminated water. Eating raw shellfish from water polluted with sewage. Being in close contact with a person who has the virus, even if that person has no symptoms. Having sexual contact with someone who has the virus. How to prevent hepatitis A virus. The hepatitis A vaccine is effective in preventing virus infection. The vaccine is typically administered in 2 doses. 6 months after the first shot, a booster shot is administered. The hepatitis A vaccine can be administered in combination with the hepatitis B vaccine. This vaccine combination is administered in 3 doses over 6 months. Disease Control and Prevention recommends the hepatitis A vaccine for the following people. All children aged 1 year or older who did not receive the childhood vaccine. Anyone aged 1 year or older who is homeless. Infants aged 6 to 11 months traveling to areas where hepatitis A is prevalent. Family and caregivers of adoptees from countries where hepatitis A is prevalent. People in direct contact with others who have hepatitis A. Clinical laboratory workers who could come into contact with hepatitis A. Men who engage in sex with person who is infected with hepatitis A. Men who engage in sex with men. People who work or travel in regions where hepatitis A is prevalent. People who use any type of recreational drugs, not just those injected. People with chronic liver disease, such as hepatitis B or C. Anyone seeking protection, immunity. When to see a doctor. For getting the hepatitis A vaccine or an injection of an antibody known as immunoglobulin within 2 weeks of being exposed to the hepatitis A virus may protect you from infection. While asking your healthcare provider or your local health department about receiving the hepatitis A vaccine when you have the following. You traveled recently to areas where the virus is common, particularly those areas with poor sanitation and the countries where the virus is predominant. You ate at a restaurant with a hepatitis A outbreak. You lived with someone who has hepatitis A. You recently had sexual contact with someone who has hepatitis A. Disclaimer. This video contains general information and discussions on health and related topics. The information and other content in the video, as well as the linked materials, are not intended to be used as a substitute for medical advice, diagnosis, or treatment. Please consult your doctor before beginning a new medication or health regimen.